people to access education and training services that are allowed under the TANF program, which is the federal program. Rhode Island became much more stricter in limiting access to education and training.
Because we certainly know that in this tough job market that more educated folks are competing for sort of the lower skilled jobs, so it must be frustrating for families to go in and look for a job that just aren't available to them because of their low skill level without having that opportunity to get some skilling up right before they can find a job that'll work for them.
Exactly.
So Representative Samini, can you tell us about the bill that you've introduced and how it would work to improve this program?
Certainly, thank you. So the bill I've introduced really addresses Rhode Island Works in two capacities. The first is that it gets rid of that periodic time limit that I spoke about earlier. So as I said before, you are able to be on cash assistance for 24 months in a 60-month period, and then an additional 24 months following that for a total of 48. And what my bill would do is to make it a full 48-month lifetime limit. So it doesn't increase the amount of time that you can stay on cash assistance, it changes the way that you can use the months. So instead of having to do 24 and 60, you can do 36, you can do 48, you could do 12 now and 24 in a year, whatever you need to do to make it work for your family. One thing that I wanted to mention is that I really think of the Rhode Island Works program is often seen as, or could be seen as an unemployment program for low-skilled workers. Many people don't recognize that if you lose a job, you're not always eligible to receive unemployment. It depends on whether or not you're able to work full-time and the amount of time you spent at your previous job. So not everyone is eligible for unemployment. And so the Rhode Island Works program can really be an assistance to people, being kind of an unemployment insurance for low-income individuals. But if they spend 2 years on the program as it stands now, you can't then get another month of assistance for another 3 years. So the short answer is it would change from the 24-month periodic to a 48-month lifetime cap.
Well, and my understanding too is that this is really supposed to be sort of safety net for children over the lifetime of their childhood, for instance. So for 18 years, if their parent needed it sort of sporadically, they could use it that way. And I guess the 24-month time limit would really shorten the amount that child would have access to the program until they turn 18.
That's very true, and we want to make sure that we are available to families when they fall on hard times. And we can't predict when that time might be, and we can't predict that if you fall on hard times for 2 years and 5, that you're not going to fall on hard times again.
Right.
So we need to make sure that we're protecting families in that way.
So then you said there was a second part of the legislation as well?
Yes, the second piece of the legislation would addresses what Heidi was just speaking about with the work first component of Rhode Island Works, which requires that families that the parent do a 4-week job search before they do anything else. And I think that in this tough economic time, and with 4 weeks being such a small period, could be such a large period of the 24-month time limit, we want to address that and make it so that families can actually take part in other TANF-approved activities in those first 4 weeks. So that would mean working with the Department of Labor and Training and the Department of Human Services to have a thorough assessment of someone's skill level, and then perhaps have them go to vocational training rather than spend 4 weeks at Network Rhode Island looking for a job that they may not be prepared to take advantage of.
Well, that sounds like a logical way to go about doing that. I'm sure that you've talked to experts in this field who've sort of looked at the best ways to do that. And is that sort of the general idea about the best way to work with this population?
It really is. And in fact, in 2008, when Rhode Island Works became the welfare program of Rhode Island, they instituted Work First, both at a time when our unemployment rate was not as high, but also there was an understanding that there would be additional caseworkers hired to help with that process of helping people find jobs. People hired at DHS and at DLT, Department of Labor and Training, and the Department of Human Services, to help people to find employment. And most of those positions were not filled since 2008. So not only is our unemployment rate higher, so it's more difficult to find a job, but the folks who are supposed to help people find jobs were not put in place. So I think that it's a win-win situation to have people have the ability to be assessed and go to the programs that are best for them, that, as Heidi mentioned, are TANF approved. We're not looking to do anything beyond the scope of what the federal government intends.
Just not make it so one size fits all.
Correct.
That's the idea.
Yes.
So how's the bill been received? Have you had a hearing on it?
Yes, we had a hearing last week, and it was very well represented, or many agencies were represented. I believe that there were 9 agencies that came out to speak in favor of the legislation. It was a diverse group of individuals. The Rhode Island Coalition for the Homeless came out to speak and talk about how when families don't get these kinds of supports, they may end up in the homeless system, and that's not a good place for them to be. The Catholic Diocese of Providence came out to support the legislation, to speak about how we have an obligation to care for the poor in our communities. The National Organization on Women spoke in favor of the legislation, as did the Rhode Island Community Action Association and some representatives of social service agencies throughout the state, from Woonsocket to Westerly.
Well, that is a diverse group, but it made for an interesting panel. Is there a Senate companion bill as well?
There is a Senate companion bill. It's I don't know the bill number, I'm sorry, but it's Senator Pichardo's bill.
Oh,
Senator
great.
Pichardo, who's also from Providence.
I think it's number 609, if my notes are correct. So I know that this is a tough budget year. So what are you thinking about in terms of paying for this bill? Do you think there's money available?
Well, it is a tough budget year, and that's what I hear most regularly from people. But there's actually been some untapped resources in the TANF program. As I said earlier, a lot of the money for the TANF program comes from a federal block grant. And that money goes towards a variety of things, including the cash assistance benefit. And some of that money, I believe about, and your notes may tell you better than my memory, but I believe it's a few $1 million hasn't been spent in the past 2.5 years, 3 years. And so there's an expectation that this may cost about $4 million, but the money is available through that block grant that hasn't been spent.
Right. My notes are very trustworthy, and they do say that there is about $14 million over the last several years that hasn't been spent, and so it looks like that those funds could be used to pay for this. So that's optimistic, right? Because then there's no state dollars that would have to go to this?
Exactly. There are no state dollars that would have to go to this. It keeps the program in line with the TANF funding. It expands to make it more in line with what the federal government puts forth in terms of a time limit that's not periodic, and in terms of allowing people to go through vocational training or other types of training before the job search.
So it would make it sort of less confusing for families? Would it make it more sort of administratively easier to administer for the workers too?
I do believe it would. I'm sorry. I do believe that it would be more. It would be easier for the administration of the program as well.
Mm-hmm. Just everybody's about efficiency these days, so that's important. Mm-hmm. Now, Heidi, are there other changes that you would make sort of on the ground, sort of not structurally about the law itself, but how the program is run?
Yes, I think there are several changes that can really happen on the ground that really can have a bigger impact on families, and especially with being a nonprofit organization who now is providing workforce training programs. CCF, through our Center for Financial Success, is now providing skills training programs tied specifically to addressing a skill within an industry and connecting parents in that industry to jobs. For instance, we're currently implementing a healthcare exploration training program that, in partnership with Stepping Up, which is a healthcare model that provides career coaching and training and job readiness services to low-skilled adults to get them into healthcare careers. And so if we are able to offer these short-term skills training programs to parents that are on Rhode Island Works programs, we can really see a bigger difference in helping them gain the skills that they need, get them into entry-level jobs within healthcare, and then be able to provide them with a career pathway where they're actually developing skills in whatever field that they're interested in pursuing within healthcare. And we're partnering with our employer partners in Northern Rhode Island to provide internship opportunities for these parents that are engaged in the training program, where at the end of the training program they'll be able to hopefully get employment within those positions, those entry-level positions, and then hopefully work with them in building further careers within healthcare. And so it's a great partnership where we're able to really work with our employer partners who have a need in filling some entry-level and mid-level positions within healthcare, but they need the skills of the adults that are interested in these particular fields.
So as it works now, Rhode Island Works, parents don't have access to these kinds of programs. Is that what you're finding?
Well, what we're hearing from many people around the state who really are providing the skills training programs is that they're not getting the referrals from the social caseworkers of Rhode Island Works parents who may be assessed. And one of the critical things that Representative Samini mentioned is that we need to make sure that we're getting parents assessed properly, and really that we're designing it in a way that's really preparing them for whatever interests them. And far too often we hear that parents are, so